All right, interventions for patients that have venous thromboembolism, typically treated with rest, but there is no study that says ambulation is contraindicated or that ambulation will dislodge the clot. We do not want to massage the area, but heat can be a warm, moist heat can be applied to the affected area. Anticoagulants are given for prevention and also known DVTs or deep vein thrombosis. Heparin, warfarin, and Xarelto are typically given. Heparin can be given as unfractionated heparin or low molecular weight heparin. Low molecular weight heparin is typically used more often. Unfractionated heparin interacts with antithrombin 3 to produce clotting factors. At higher doses, it inhibits all clotting factors. Low molecular weight heparin inhibits thrombin formation. Warfarin or Coumadin works in the liver to inhibit synthesis of vitamin K-dependent clotting factors. It is not uncommon for the patient to be placed on heparin initially and then Coumadin PO added to the medication regimen. Heparin is given to help to dissolve those clots. Before administering heparin, it's important to monitor the patient's APTT. We want to get a CBC, and occult blood checks should be obtained to monitor for bleeding. Prothrombin is produced by our liver and helps our blood to clot. PT stands for prothrombin time. INR is international normalized ratio, and that monitors the effectiveness of warfarin. APTT is activated partial thromboplastin time. This test is performed to make sure blood thinners are working appropriately. Heparin can decrease in platelet counts. Heparin-induced thrombocytopenia can occur, and the provider discontinues the heparin when this happens. It's important to remember that APTT are checked lab values, as well as the antidote for heparin is protamine sulfate. Those receiving Coumadin will have their PT and INR checked, and they will also want to have vitamin K on hand because vitamin K is the antidote for Coumadin. Coumadin should have an INR between 2 to 3 if the patient's receiving Coumadin. The normal value for the INR is 0.8 to 1.2. If you will, read chart 36.7 on page 732 and chart 36.8 on page 733. With heparin, if renal insufficiency is present, the dose should be lowered. Thrombectomy is a procedure for removing a blood clot. Filter devices are inserted into the inferior vena cava or into the femoral vein for those with recurrent DVTs. And those filters help to catch, so to speak, the blood clots. After these types of surgeries, we want to inspect the groin for bleeding or infection. We want to make sure that we're teaching patients to stop smoking and to avoid oral contraceptives. We want to teach patients to avoid things that could cause easy bruising, avoid shaving, avoid brushing teeth too rough. We want to teach these patients that pressure should be applied to bleeding wounds, and they should seek medical assistance if they do have a bleeding wound. They should also tell their dentist that they are on Coumadin, warfarin, heparin, Xarelto, any type of blood thinner. Okay. Venous insufficiency. Venous insufficiency occurs as a result of venous hypertension that damages veins and valves. Those who suffer are standing or sitting for long periods of time, and individuals that suffer from obesity. Thrombus formation can also contribute to venous insufficiency. Edema of both legs is evident. Stasis dermatitis is a reddish-brown color that's along the lower legs and can extend up the calf. Stasis ulcers can develop from edema or injury to the leg. The inner ankle and outer ankle are the two most common places for stasis ulcers to appear. Interventions are to increase venous return from the affected leg or legs and to decrease edema. Stockings should be worn, compression stockings should be worn, and the patient's legs should be elevated at least 20 minutes for 4 to 5 times a day. Please read chart 36.9 on page 734 and read about varicose veins on your own. It's a short section. You cannot remember everything. Don't focus on remembering everything. When you are studying, make sure you are looking for what the disease process is, how it's occurring in the body, and most importantly, what you as a nurse should be able to assess, identify, or what intervention you would provide for the patient.